Okay, so now we will be looking at acute bacterial meningitis, its causes, clinical features, treatment, laboratory investigations, and all about acute bacterial meningitis. So, incidence of acute bacterial meningitis about two-thirds of all cases occurring in childhood and more common in childhood age compared to infancy. ठीक. And then there are more problems in Pakistan related to acute bacterial meningitis, and etiology is 1 to 2 months it is occurs, and the organisms are GB streptococcus, gram negative bacilli, listeria monocytogenes, H influenza encapsulated type. And in 2 months to 12 years, more common organism are streptococcus pneumoniae, pneumococcus influenza type B. Are in immunocompromised patients, there will be pseudomonas, staphylococcus aureus, coagulase negative, salmonella, and listeria monocytogenes. So these are causative agents in different years of the age. So risk factors for meningitis are lack of immunity for a specific pathogen, a recent colonization with pathogenic bacteria, close contact with the households, and overcrowding, poverty, male gender, altered immunoglobulin productions, encapsulated pathogens are there, may be defect in complement system, are defect in propagation system, splenic dysfunction, T lymphocytic defect, congenital acquired CSF leak, lumbosacral, dermal sinus, meningocele, and CSF shunt infections. So these are all the types. And then the mode of transmission will be from otitis media, and any infection, acute subacute otitis media may travel into the brain and meninges, and then meningitis can occur. Or mastoiditis, or blood-borne infection, or sinusitis can also give rise to the meningitis. So, what clinical features will be observed? Clinical feature will be present with the shock, purpura, DIC, fever, anorexia, poor feeding, and acute respiratory infection with myalgia, joint pain, arthralgia, muscle pain, myalgia, arthralgia, joint pain, and myalgia, muscle pain, tachycardia, hypotension, purpura, petechiae, and erythematous maculopapular rashes are present. So, a specific finding for the meningitis will be signs of raised intracranial pressure will be there, headache, emesis, bulging of the fentanyl will be there, oculomotor or abuse and palsy will be there, hypertension, bradycardia, decorticate and decerebrate postures will be there, stupor, coma, herniation, meningeal irritation will be positive, like Koenig sign and Bruschi sign will be positive. Leg Koenig and neck Bruschi will be positive in meningitis. Seizures will be there. Altered mental status will be there. And then diagnosis will be performed on the basis of CSF culture, and raised protein will be there in CSF. Decreased sugar will indicate the increased number of cells, polymorphic, and isolate the organism. CP, blood culture, blood sugar should be looked. CT, MRI, fundoscopy should be performed. These are all laboratory investigations for the diagnosis. The differential diagnosis DD will be viral meningitis, cerebral malaria, TB meningitis, and space occupying lesion of the brain can be kept as differentials. How can we treat the meningitis? For treatment will be feeding should be through IV fluids, control the fits with diazepam and phenobarb, control fever and paracetamol, bowel and bladder care. Mannitol should be controlled mannitol should be given in raised intracranial pressure. Combination of penicillin should be given. Third generation ceftriaxone should be given as an antibiotic, and duration therapy should be given in order to save the life of the patient. What complication can occur in meningitis? For acute, there will be cranial nerve palsy like third, fourth, sixth, seventh cranial nerve palsy. A stroke will be there, cerebral herniation, thrombosis, subdural effusion, and syndrome of ISADH will be there, DIC, and Waterhouse Fredrickson syndrome can be there. Later complication will be mental retardation, epilepsy, paralysis of the body, hemiplegia, paraplegia, and monoplegia, deafness, visual impairment, hydrocele, cerebral palsy, microcephaly, and attention deficit disorders will be there. So these are all complications of meningitis, and we can treat the patient by these modes.